Good morning, students. Today we'll be discussing about hypoglossal nerve, and in this I'll be covering the functional components and nuclei, course and distribution of hypoglossal nerve, branches and applied anatomy related to hypoglossal nerve. So first we'll discuss about the functional components and nuclei. As you know, hypoglossal nerve is the 12th cranial nerve and it is having a single functional component, that is it is carrying the general somatic efferent fibers. So usually these fibers they will supply the skeletal muscles which are derived from the somites. So here these fibers are coming from the hypoglossal nucleus which is located in the medulla, and it is supplying all the intrinsic and extrinsic muscles of tongue except palatoglossus, which will be supplied by the accessory nerve, cranial part of the accessory nerve. So you can see here this is an image showing the hypoglossal nucleus, and you can see the hypoglossal nerve coming from the hypoglossal nucleus and it is exiting between the pyramid and the olive. Coming to the course and distribution, hypoglossal nerve arises from the anterolateral aspect of medulla between olive and the pyramid as 10 to 15 rootlets, and these rootlets will fuse to give rise to two roots. In this image, you can see that from the hypoglossal nucleus, you can see there are a lot of rootlets, 10 to 15 rootlets, which are coming out uh, between the olive and the pyramid, and you can see that these rootlets are fusing to form two roots, and after formation of the roots these roots will unite to form a single nerve as they pass through the hypoglossal canal and through which they will exit the cranial cavity. After exiting the cranial cavity, they will pass forward between internal jugular vein and the internal carotid artery, and they will run forward uh, superficial to the internal external carotid arteries and a loop of lingual artery to reach the part above the hyoid bone. So here you can see that after or at the point of exit of the hypoglossal canal, these roots, the two roots are fusing to give rise to the single hypoglossal nerve, and after which they will pass between the internal jugular and the internal carotid artery. Then the nerve will pass anteriorly in front of this internal carotid artery. This is the external carotid artery, then the loop of lingual artery to reach the part above the hyoid bone. So next, here at this point, that is at the point above the hyoid bone, here it is going to divide into a lot of branches which are going to supply all the intrinsic and the extrinsic muscles of the tongue except palatoglossus muscle. And while it is coming from the hypoglossal canal, it is joined by the anterior primary ramus of C1, which forms the superior root of ansa cervicalis. And you can see here, this is the meningeal branch coming from the anterior ramus of the C1. It accompanies the hypoglossal nerve throughout its course, and it is going to supply the styrohyoid muscle and the geniohyoid muscle. Okay, so these both will be supplied by the C1 ramus, and this is going to form the superior limb of ansa cervicalis, and it is going to supply few more muscles through this limb. Next, coming to the branches of hypoglossal nerve, it gives branches to supply all the intrinsic and extrinsic muscles except palatoglossus, which is supplied by the cranial root of accessory nerve. Here you can see the different branches coming from the hypoglossal nerve. So here its formation from the hypoglossal nucleus. So this nerve, hypoglossal nerve, it is exiting through the hypoglossal canal. It is accompanied by the meningeal branch of C1. It is getting few communicating branches with the sympathetic ganglion and the vagus nerves, and then it goes down, passes between the internal jugular vein, internal carotid artery, then it goes anteriorly, superficial to internal carotid, external carotid, loop of lingual arteries, and then it is reaching the position above the hyoid bone where it is going to divide into a lot of branches. You can see this branch, it is supplying the styloglossus muscle. One more branch supplies the hyoglossus muscle. and then you're getting branches supplying the vertical muscles, superior longitudinal muscles, transverse muscles, inferior longitudinal muscles, and the genioglossus muscle. And the C1 ramus, which is accompanying it, will supply the thyrohyoid muscle and the geniohyoid muscle. It is forming the descendens hypoglossal, which is the descending limb of ansa cervicalis, and through this limb it is supplying the sternohyoid, sternothyroid, and the anterior belly of homohyoid muscles. So this is about its branches and distribution. So next, coming to the last part, that is applied anatomy. So hypoglossal nerve injuries can be happening at an upper motor neuron level and at the nuclear or below the nucleus level. So if it is happening above the nucleus level, that is if there is an upper motor neuron lesion, so we should know that this hypoglossal nucleus is receiving the corticonuclear fibers only from the contralateral hemisphere. So if, for example, the left side corticonuclear fibers are damaged, so what happens is the right side, the right half of the tongue will be paralyzed. So on protrusion, if you see, the tongue will deviate to the opposite side of the lesion. So if there is left side corticonuclear fibers getting damaged, the tongue will be deviated towards the right side, because right side the muscles of the tongue are paralyzed, and usually protrusion of the tongue is action which is carried out by the glossus muscle. So on protrusion, the normal side will be able to protrude, but the paralyzed side will not be able to protrude. So tongue will be deviated towards the paralyzed side. And in the lower motor neuron lesion, so here then it happens when there is a nuclear or an infranuclear lesions, and this results in the paralysis of the same side half of the tongue or the ipsilateral tongue. So on protrusion, as you know, the tongue will deviate towards the paralyzed side, that is the side of lesion, in case of lower motor neuron lesions. So you can see here, this is the genioglossus muscle action of it. So if the tongue is paralyzed onto the right side, then the tongue will be deviated towards the right side. If it is paralyzed on the left side, then tongue will be deviated towards the left side, because the unopposed action of the normal side. Okay, so this is about the hypoglossal nerve. Thank you.